Good afternoon. My name is Crystal Evans, and today's presentation is entitled Integrating Community Voices in the Research Continuum Perspectives on a Consultation Service. The objectives of today's presentation are to describe the formation, evaluation, and redesign of a community engaged research consultation service. Before I begin, I'd like to tell you a little bit about myself. I have over 20 years of experience working in community engaged research. I became interested in this field when I was 16 and served as the primary caregiver for my father, who suffered a stroke. It was my responsibility to accompany him to all of his doctor's appointments, and most of them were pretty uneventful until he was diagnosed with dementia. I remember the doctor telling us that he had dementia and that at that time he was taking notes. He did not look up from his notepad or explain to us what dementia meant, what it was. When I asked him what does dementia mean, he continued to take notes and he never answered my question. I left this appointment feeling like I just had a one sided conversation where a healthcare provider shared information with me without explaining it, and that I left not understanding what it meant or how it would impact my family. And in my opinion, all conversations about my health and my family should include me and reflect my lived and learned experiences. And this is because this is why I'm really interested in community engaged research because it involves working very closely with community stakeholders, groups that are directly impacted by the research topic, and those groups who have an invested interest in the topic. So, when we think about community engaged research, we must reflect on the approach. It does not include research that's conducted on our community members or our community, or community research that occurs within your neighborhood but does not involve any real partnership. We are referring to an approach in which researchers collaborate with diverse stakeholders as equal partners throughout the entire research process. This approach is very important, especially when we're referring to very diverse and minoritized communities, such as the one that I live in Maryland. In 2007, the Johns Hopkins Institute for Clinical and Translational Research was established to address health equity issues within Maryland within a research and discovery lens. The Community and Stakeholder Engagement Core serves as the hub for our Institute's engagement with patients, community members, and diverse stakeholders, both in partner formation and the design and implementation of research. In 2009, the Community Research Advisory Council was established, and it was formed to help promote trust, understanding, and engagement in the research process. We partner with the Community Research Advisory Council to offer our community engaged research consultation service, which is a resource that is available to faculty, staff, and students within Johns Hopkins University and Johns Hopkins Medicine. And this service is built upon the community informed approach utilized by the ICTR. And within the Community Stakeholder Engagement Core, we are all about focusing on bi directional communication where information is shared back and forth, creating safe and inclusive spaces that allow individuals that brave space, that freedom to discuss tough topics and to agree to disagree at times respectfully. And again, the community engaged research consultation service, hubbed underneath of the Community Research Advisory Council, is an example where all voices are respected, all skills and expertise are compensated, and we value diverse perspectives. So, when we think about the community engaged consultation service, it focuses on the areas in green. Again, our framework within the community engagement and stakeholder engagement core is to recognize that community perceptions are influenced by lived and learned experience. This is true for all aspects of our lives, but in particular with research, where there are historical and contemporary negative or harmful incidences that have occurred within various communities. As a community engaged consultation service, it is imperative for us to help educate and inform our researchers that there are instances that have fostered mistrust and lowered community members' willingness to be involved in the research process. So, this service again has been offered since 2009. And before the pandemic, we provided consultations 4 times a year. And these consultations consisted of 90-minute in person meetings in which research teams provided 1 hour presentations, and CREC members, community engaged research consultants, were provided 30 minutes to respond to pre selected questions. This research consultation service was utilized at all phases of the research process, but what we noticed was that most investigators and research teams approached us during the recruitment phase, during the midpoints of their studies, to figure out how to get the word out and increase representation. Some individuals were also referred to our services by the Institutional Review Board, which is the Research Safety Monitoring Board. To, in keeping with our approach of community informed services, we conduct ongoing evaluations of our community partner and researchers' experience utilizing and engaging in our community engaged consultation service. So in 2016, from 2016 to 2018, we began evaluating our service to redesign and plan for a more streamlined and enhanced experience for both our researchers and community stakeholders. So we first started off by administering a researcher experience survey. The survey was to determine what researchers found helpful and what areas we could improve in our service delivery. We emailed 28 researchers a copy of a survey to complete using Qualtrics, and 14 of the respondents completed the survey. Most notable feedback that we received was that researchers appreciated gaining access to diverse stakeholders with lived and professional experience that helped inform their study designs. Researchers informed us that the feedback from the community engagement consultation service was integrated in their study design, recruitment practices, and in survey instrumentation. The most notable feedback from the research teams was that listening to community members share their lived experiences and concerns about safety, trust, and historical and contemporary incidents of racism helped them better understand and appreciate community questions and concerns about studies. Similarly, the Community Research Advisory Council members expressed an appreciation for their engagement with research teams. We sent out 22 surveys by email to CRAC members and yielded 19 people responding. And overall, we received very positive feedback. CRAC members described the engagement as empowering and stated that they really appreciated the opportunity to help researchers establish the right questions the first time and sharing findings with community members. Now, during the pandemic, even while we were in the midst of planning our redesign, life happened. We had to pivot very quickly from quarterly meetings to quarterly in person meetings to weekly virtual meetings in response to the COVID-19 social distancing requirements and to respond to the institution's need for community engagement and input and for the rapid discoveries that were being piloted. So, as a CRAC and the Community Engagement Consultation Service, we continued to utilize our community informed approach. Our, our consultants invested their time and willingness to provide weekly consultations, and our core promote, um, promoted equitable participation by providing free tablets, access to Wi Fi, and training individuals on how to utilize Zoom and other online modalities. So, again, our investments were in staff, financial investment in technology, and working very closely with our CRAC members on capacity building. Based upon the feedback from our survey and a stakeholder meeting that we hosted in 2019, we began to reshape our consultation process. We added two additional steps. We formalized our iterative interaction with our researchers and our technical staff to make that more formalized to ensure that all parties were clear on the goals of the research consultation. We hired a staff person to provide support from start to finish on consultations and to work closely with both the CRAC members and the research teams from the beginning and end of a study. In response to the CRAC members and the research team's request for increased visibility, increased service utilization, we we provided more opportunities for our advisory board to engage with the research community. We partnered with the pre-doctoral clinical research training program to create an opportunity for our CRAC members to mentor early career researchers, students who are in medical school, graduate school, who are very interested in learning more about community engaged research. We also gave the members opportunities to organize virtual conferences on healthy aging. And through these efforts, even when the pandemic ended, we were able to increase our engagement and utilization of our surveys and our services over a 3 year period. So, the key takeaways are that community engagement is an essential component to development and translation of interventions within the healthcare system. The Community Research Advisory Council at the Johns Hopkins Institute for Clinical and Translational Research is a model for providing community engaged research consultations and the utilization of community informed and centric approaches. More research should be done to evaluate the experiences of individuals participating in consultation services. And we look forward to continuing to explore these issues throughout our next grant cycle. My name is Crystal Evans, and it has been an honor to present to you today. If I looked at my younger self and to health professionals, I encourage you to think about research and clinical care as a two-way exchange, two-way communication. Practice your listening skills and be willing to respect the lived and learned experiences of all stakeholders in the relationship. Thank you for your time.